it's Marnie with the Clutter Movement. Today I wanted to take a few minutes to go through the diagnostic criteria for hoarding disorder. A lot of people associate hoarding disorder with what we see on TV, high levels of clutter. In actuality, there's a difference between the mental health diagnosis of hoarding disorder and hoarding behavior. So I wanted to go through the diagnostic criteria step by step so that it can give you a better understanding of what the difference between the two is. So first of all, I'm going to use the book Treatment for Hoarding Disorder, the second edition by Drs. Gail Steckity and Dr. Randy Frost. So this is the version here that I'm looking at, which is the therapist's guide. There's also a manual to this, so if you happen to be a clinician and you're interested in treating people with hoarding disorder, this is an excellent resource for you. Now, that being said, I'm going to read here because I want to make sure that I get all the wording right. So now we're diagnosing somebody or attempting to see if somebody actually has hoarding disorder. The first thing that we're going to look for is persistent difficulty discarding or parting with possessions, regardless of their actual value. Again, persistent difficulty discarding or parting with possessions, regardless of their actual value. This is a real sticking point because a lot of people exhibit this behavior where it looks like they're holding on to things, or let's say they're in an office with a therapist and you're trying to determine if this person has hoarding disorder and they say, yeah, I can't get rid of anything. So sometimes this is hard to see. I prefer to see this in the home so that we can work through some of it to be able to better understand if this is an actual true representation of what is going on. So for example, I don't know if many of you are familiar with squalor. I know some are. So squalor is an environmental issue. Squalor is the buildup of literal trash. And with squalor, the items that are in the home actually have no purpose for the person that is in that home. And they are more than happy usually to have people come in and just take them away. Now, with hoarding disorder, the person has a purpose for those items. Even if we might see them as trash, the person has a purpose for those items and they're not going to be able to let them go, or they're going to have extreme difficulty. Now you can have hoarding disorder, you can have all hoarding, you can have all squalor, or you can have hoarding and squalor combined. And if you think about it, if you have hoarding, the squalor builds up because if you live in a very highly cluttered environment, and you're trying to get the trash out, trying to get the dishes done, trying to get, take care of the cat box and things like that. How do you do that when your environment is so cluttered that you can't get to those things and be able to do those processes? So going back again to hoarding disorder, in that first criteria, extreme difficulty or the inability to let something go. If you're working with somebody and they say, yeah, I can get rid of that. Well, maybe I'd like to keep this, but I can get rid of those other things. This person may not actually have hoarding disorder. They may actually meet criteria for hoarding behavior. So the second thing that we're looking for is the difficulty is due to a perceived need to save the items and distress associated with discarding them. So again, we have somebody who has extreme difficulty or the inability to let something go, and this difficulty is due to perceived need to save the items and the distress associated with discarding them. So if you're working with somebody that meets that criteria, then they likely have hoarding disorder. But if you're working with somebody who is really, let's say they're just had some medical issues, there's a lot of clutter in their home, things are disorganized, but when you start helping them, they're able to let things go. There's not a lot of distress. There might be distress with some items, but maybe not others. If you're working with somebody who's getting rid of more things than they're keeping, you actually may not have somebody who has hoarding disorder. The third thing that we look at is the culmination of number 1 and 2 is that the difficulty in discarding these possessions and the accumulation of possessions makes it so the home, you can't use rooms or surfaces for their intended purpose. This doesn't mean that you can't use the dining room table. What it means is you can't use your home to do the things you should be able to do in your home. Like maybe there's no place in the kitchen to prepare food. Maybe you can't get to the bathroom. Maybe you're not sleeping on your bed, or if you are, it's a very small area. So again, if you're taking the diagnostic criteria with the extreme inability or extreme difficulty and inability in letting things go, and a lot of distress associated with being able to do that, things build up. And in that building up, then we're unable to use the home or parts of the home as they were intended. The next thing we look at is the level of stress. So in reading this, it says, the hoarding causes clinically significant distress or impairment in social, occupational, or other important areas of functioning, including maintaining a safe environment of self and others. So we've got the difficulty or extreme inability or to let things go. We've got the difficulty being perceived to need to save the items and distress associated with discarding them. These behaviors or these thought processes cause items to build up and build up. And because of that, there's a lot of distress that's added to that. Now, that's some of the diagnostic criteria, but the next thing that we're looking at is that we have to say that the hoarding is not attributed to another medical condition. For example, a brain injury, cerebrovascular disease or dementia, or Prader-Willi syndrome. So again, if hoarding disorder is chronic and progressive, so if you have somebody who starts hoarding or the hoarding behavior starts suddenly, you likely don't have somebody with hoarding disorder. This would be brought on by something, maybe a medical condition, again, like dementia, like they say here, traumatic brain injury. The next thing that it states in the diagnostic criteria is the symptoms are not better accounted for by the symptoms of another DSM-5 disorder. So for example, obsessions and obsessive compulsive disorder, decreased energy in major depressive disorder, delusions and schizophrenia, or another psychotic disorder, cognitive deficits in major neurocognitive disorder, and restricted interest in autism spectrum disorder. So in thinking about that too, let's say for example with depression, as it says here, with depression, decreased energy. So if somebody is depressed, how does that feel? What does that do? Your energy is decreased, your motivation is decreased, your sleeping patterns are probably not the same as they used to be or not what we typically call normal. And what does that do to your ability to process and ability to make decisions? So if you have somebody who's going through a severe depression and they're not clearing out and going through things, then you're going to end up having to mute your phone. You're going to end up having the clutter building up. And with that, once the depressive symptoms have been managed or are alleviated to some degree, you're better able to start letting go of items. So in thinking about that too, we really have to take into account what else is going on in somebody's life. If they have hoarding disorder, that main thing is extreme inability or extreme difficulty or inability to let things go. That's the primary thing, the primary feature that we're looking for. If somebody, once their symptoms, the other mental health symptoms are alleviated, is able to let things go, then guess what? We likely don't have hoarding disorder. We have hoarding behavior based on other mental health issues, maybe some other physical issues, and those things need to be addressed first so that the person can start to decrease the clutter.